Bariatric or metabolic surgery is often viewed just as a way to lose weight, but many doctors now see it also as a way of reducing other serious and life-threatening medical conditions that often accompany morbid obesity. Dr. Joseph Chablis from Venice Metabolic and Bariatric Surgery is here to explain, and he brought two of his patients with him, Jeff and Carol Moser from Englewood. Welcome to all of you.
Thank you.
Let's start with the Mosers. What health issues were you dealing with that made you want to consider bariatric surgery?
Well, for me, it's been well over a 20-year battle. I've had multiple comorbidities. I've had very serious cardiac issues. I've also had very serious diabetes, sleep apnea, and those things can augment out into other major issues with your health.
And we're looking at a before picture here.
Oh,
How much weight did you lose?
101 pounds.
Wow, congratulations.
Oh, you're my hero.
Congratulations.
And you know who my hero is?
My husband.
Bud Carson.
Oh, that's so great.
Go Browns.
Now, Carol, you did this alongside of Jeff.
Yes.
What made you want to do this?
Well, we're retired nurses, registered nurses, and we were hospice nurses. And we know the end disease process. And we were going down that road, and we want to be around longer for our grandchildren and everything. And I had just started having this sleep apnea, the CPAP machine, the high cholesterol, the blood pressure medication, and I'm going to tell on you. I'm sorry, but he had 3 heart attacks and a 5-graft bypass. So he had serious cardiac issues. And you know, when we started investigating and looking into this and seeing the health benefits from this surgery, we were like, we got to do it.
All right, Dr. Chablis, I love that we are talking so much more about the health than just the weight loss. Not that that isn't important, but you're saving lives here.
Yeah.
Tell us your impression of the Moser situation and why it drew you to them when you met them.
Yeah, I remember the first meeting we had very well because it's not often you get to meet two very highly educated colleagues and professionals. So I remember we spoke a lot about what we call the weight loss independent effect of these operations. You know, we want to focus, and I think we should focus as a society on getting people to understand the health benefits and the improvement and often, hopefully, the resolution of these very complex medical problems and control of medical problems to help people live longer, to have them have a better quality of life, to eradicate disease. And that's what we really should be focusing on.
So obviously the surgery aids in weight loss. How does the weight loss aid in the changing and eradication of the type of problems that the Mosers and so many people with obesity have?
So what I would probably say more importantly is that at the time of surgery there are important hormonal changes that occur that are independent of weight loss. See, I think even our cardiologists are convinced that we do the surgery, people lose weight, their health gets better. We know that's not the case anymore. People have the surgery, these metabolic and hormonal effects occur, and people, they have less likelihood of having a blood clot, less overall systemic, what we call inflammation. They live longer. Their health problems improve indirectly, independently of the weight loss effect. The weight loss effect is important. There's no question about it. Certain disease states are very related to weight. You know, joint disease and sleep apnea, but most of the other diseases, type 2 diabetes, lipid problems, fatty liver disease, these are important societal problems. And these are improving even before weight loss.
But it's still no immediate magic pill, Jeff. You said you've had to work very hard, you and Carol. Tell us about that.
Right. I look at this as a jump start for me. But you have to work a program, and you have to work it every day. Sometimes minute by minute or hour by hour. I mean, there are old habits that you still have to deal with, and you have. I would strongly recommend people that do this to make sure that you have a good, strong social support group. And of course, you want that health care folk to be involved in that. Dr. Chablis has been amazing. His office staff has been amazing.
Good.
And as I say, you got to work it every day. Meaning that you do need to look at what you're going to eat and how you're going to prepare And it is a lifestyle change, believe me. For instance, you don't eat your meal in 5 minutes or 10 minutes. You try to take 30 minutes.
And the little things matter, and I bet having support in your house and doing it together matters.
And I also want to interject, you do need to exercise.
Absolutely.
Okay, for me, I choose to swim.
But you feel like exercising.
Right.
You're losing the weight, and it's like,
This is
okay,
true.
I can do this
And you've
now.
got some energy.
Right,
So, all right, well,
exactly.
all
Right.
positives.
Exactly.
Congratulations to
Thank
both you.
you.
We wish you the
Thank
best
you
in
very
your
much.
continued
You are
health recovery.
shining example.
Yes, you are. And Dr. Chablis, thank you,
Thank
of course,
you,
for
thank you,
bringing
thank
out the
you.
medical
Thank you
reasons
to
why
them.
this is such a great thing. Also, a quick congratulations to Dr. Chablis. He's the chair-elect of the Governor Scott's Diabetes Advisory Council. To contact him and find out more about bariatric surgery and all its many medical benefits, you can go to VeniceMBS.com.